Hello and welcome. This is Health Promotion Practices Author Interviews, and my name is Arden Castle. Each episode, we will explore a recently published article and its author. This week, I'm joined by Dr. Aditi Srivastav, author of Moderating the Effects of Adverse Childhood Experiences to Address Inequities in Tobacco-Related Risk Behaviors, which was published in January 2020, and The Empower Action Model, a framework for preventing adverse childhood experiences by promoting health, equity, and well-being across the lifespan, which was published in November 2019. I am also joined today with Dr. Aditi's colleague, Michael Shirley, Community Education Manager of Children's Trust of South Carolina. And this episode is focused on how her paper connects to the larger public health field, which is one part of a three-part series with Dr. Aditi Srivastav. And so tune in to our other episodes to hear more about her and her other authors. But we'll go ahead and get started. So can you tell us a little bit about working with Children's Trust of South Carolina?
Yeah, so I am the Director of Research at Children's Trust of South Carolina. We are a statewide agency that's focused on the prevention of child abuse and neglect, but we also believe that in order for us to prevent the bad things, we have to promote the good things. So we do a lot of work around strengthening communities and families to make sure that children have everything that they need to succeed and thrive. So being a researcher in a nonprofit setting, I've really had the unique experience of not only conducting original research, mixed methods research really focused on child well-being, addressing racial disparities, and even looking at things like public opinion around these issues. I get to work with a lot of great colleagues that are really in the field, and I'm able to help them build up their practices and build up their knowledge and understanding of what the research shows to make sure that they are promoting good evidence-based decision-making, data-driven decision-making, and most importantly, that we are really able to translate that research into action. So actually, I brought a guest today, my colleague and friend, Michael. He is a community education manager, but for the purposes of our discussion today, he also plays the really important role of being our Empower Action Model coach. And that is a term that we have coined because it really speaks to the way in which we are implementing this model. And I'm sure he'll tell you a little bit more about that. But there's some really, really exciting things to share about the Empower Action Model and what we've done specifically in South Carolina since when the paper was first published in November.
Excellent. As you mentioned, I've published 2 articles on adverse childhood experiences in Health Promotion Practice Journal, one in January of 2020 and the other in November of 2019. So although they came out fairly recently, time has certainly passed between the conceptualization and publication. So how's implementation going and what's changed?
Yeah, so I will just share really briefly about what has changed since that paper, and then I really want Michael to share some of the experiences of implementation. So when we had first submitted that paper, and then like you mentioned, between publication and now, there's been a lot that's happened. We've learned a lot. And the great thing about the Empower Action Model is that it can be used in many different ways. The way that we are using it is in 3 coalitions across South Carolina. Michael works with one of those coalitions and is familiar and has great relationships with the other 2 as well. But we really thought intentionally about the ways in which we can use this model. And so in the paper, we talked a lot about how we found that the collective impact process was very helpful, specifically around making sure that you have the right folks at the table, you have shared decision making, you have decisions being made that aren't duplicating rather than building upon the strengths in a community or context. And so we have spent a lot of time really understanding what collective impact means. Simultaneously, we have been fortunate to learn a lot about implementation science, which is a new kind of evolving field in public health as well. We've been able to learn from our colleagues that are working on a program called the Positive Parenting Program, Triple P, and really learn about what it means to be what they call an intermediary organization. And so Children's Trust is an intermediary organization, which means that we don't work directly with children and families. We don't provide direct services, but we work with organizations to make sure that what they're doing is the best that they can do and is grounded in data-driven decision-making. And so that's really where this idea of coaching around the Empower Action Model has come out. So I guess I would ask that question to Michael. Michael, how do you think implementation's going since we first had this paper published?
Sure. Thank you for inviting me here today. And I'm happy to share some of my experiences with the coalitions. Have been fortunate to have some interaction with each of the three coalitions that we're currently working with. And it's been amazing to see how the different groups of people have taken the same information and digested it in different ways and come up with different strategies that help meet the needs of their communities. And that's one of the really awesome things about the Empower Action model is that it's not telling communities exactly what they need to do, but giving them the tools to try to figure that out on their own. And that's really a shift in the mindset of a lot of folks from the way that we've funded programs in the past. A lot of organizations or groups sort of expect an organization like Children's Trust to come in with a program and say, here's the evidence-based program that you need to deliver, and here are all the deliverables. But what the Empower Action model says is, here are the conditions that you need to meet in your community in order to build up resilience and the protective factors. And so that's just a really different way of thinking about it, and took some time for the folks that we work with to sort of figure out and think about what types of strategies would help meet those conditions. And so once we started to meet, I'll talk about a coalition in the Midlands of South Carolina and Columbia, South Carolina. It's called Resilient Richland. They named themselves that. And we started off with a group of really program-oriented folks, people who were vice presidents of programs or chief program officer, people who were leaders in the field, who knew their stuff about those evidence-based programs. But once we sort of started to have the conversations around the Empower Action model, they fell silent. There wasn't a whole lot of input. They really were having a hard time connecting some of those program outcomes to the conditions that are created through the protective factors. And so one of the things that the team at Resilient Richland, we're partnering also with the local United Way, who's leading the effort on the local level. And they decided that they wanted to focus in on a single zip code that really saw the greatest need and the highest disparities. And once we made that shift, it made sense to connect with a whole different group of people. And I think if we weren't using the collective impact process along with the Empower Action model, that we might not have made that change, but that change really shifted the conversations. And once we had those community level folks as a part of the conversation really bloomed, and we were able to move the work forward in a more coordinated way.
And I think that Michael makes a really excellent point there in terms of the role that a lot of the program people he refers to, and frankly, sometimes researchers and evaluators play. While we can certainly serve as the content experts on what's the best practice around ACEs, we also have to recognize when it's time for us to step aside and let those who have lived and experienced in the community really lead. And that took time. I think that took a lot longer than what we had expected. Also, when you think about the ways in which a lot of funding of research projects or programs happen, you have to really work to help funders and people understand that this type of work is very flexible and fluid, and it takes time. And so that was something that I really enjoyed seeing, how Resilient Richland had some really strong leaders in a very specific way at the beginning that needed to be there, but as it had evolved, how it turned into something that was much more led by the community. And that's the intent, right, around this model, is that anybody, regardless of how many letters they have behind their name, can understand why ACEs are important to prevent, and that they have a role in doing that, and that this is a tool that they can use in order to do that. So I appreciate him sharing that story.
I love that. And I love that you're intentional about what your role is. I mean, you're a coach. You're not coming in with this top-down approach, really acknowledging the community knowledge and expertise there and helping them build up. I think that that's really exciting. Let's see. I'm kind of curious, how has the ACEs literature changed now from the original 1997 study to the work that you have done to where we stand now? Kind of big picture, how has the literature changed? Like you said, moving more towards everyone should see that this is a problem. And where are the gaps still?
Yeah, so that's a good question. I think that the ACEs literature has evolved a lot since 1997. I actually would say within the last 5 to 7 years, we've seen the most movement. Just today, there was a report released from a well-respected think tank, the Center for American Progress, that is really starting to look at ACEs in different dimensions beyond the original 1997 study. So as we talked about in an earlier segment, typically ACEs had been looked at in terms of experiences of abuse, neglect, and then what happens in the home or what they consider household dysfunction. And so over time, kind of aligning with the Empower Action model, certainly, and the social ecological model, which is very much, I think, a foundational theory in public health. Even ACEs researchers are recognizing that experiences are not just shaped within the home. And so we need to look at experiences beyond the home as well. And so I think you're starting to see a lot of research evolve the definition of ACEs and what that means beyond the traditional types. And then, of course, and Michael alluded to this a little bit, I think that for many people, ACEs has also become a frame to address inequities and disparities. And so what do disparities in experiences, what impact do they have across the lifespan? Or how is disparities in exposure to these traumatic events really panning out? And how can we contextualize that in terms of what we know that communities of color are more likely to face? And so those are some of the things we're starting to see. And then a really kind of cool direction that Children's Trust is also going is looking at the positives as well. So we have been collecting data on positive childhood experiences, and we hope to get that data in the next month or so. We'll be collecting it from 2019 to 2021. I think we'll be the second or third state to do that, but I think that will really give a full picture of what early childhood experiences, what their impact can be, right? We also know that just because a child has experienced a ton of ACEs doesn't mean that they didn't experience positive things in their life too, right? Experiences are they're very fluid. And so we are really excited to have that data as well to really be able to share and use also with the Empower Action model. One of the things that we haven't yet talked about is the readiness process. And this is kind of a really nice way that my role as a director of research and then Michael's role as our community education manager and coach have come together is when we had the coalitions go through this comprehensive review of data. So I actually was hoping that Michael would talk a little bit about how even some of the ACEs data we have right now, these coalitions really looked at and thought about and what their experience was like there.
Sure. So everyone has a little bit different level of comfort when it comes to the data, but we're actually fortunate at Children's Trust to have a strong communications team as well who helps us to digest that information so that community members can use it in a data conversation. We also built some tools and resources for folks to know the questions to ask and what to be looking for when you're taking a look at the data profiles. And so we looked at 3 profiles in particular. One is our child well-being profile. That's from the Kids Count information from the Annie E. Casey Foundation. And then we also created ACE profiles, and those are both on the county levels. And a more recent profile that we developed was with our child maltreatment data from the Department of Social Services. And so we provided those profiles for the county that we're serving, Richland County for Resilient Richland, and had the committee members sort of take a look at those and see what are the commonalities, what are the themes across the profiles, what stands out to you, what are some of the strengths, what's going well per the data, and what are some areas that you either have questions about or that you see as opportunities for us to address through our work as a coalition. And so that was really interesting, especially to hear perspectives, because some folks on our coalition did have that data background and knowledge, and they asked questions. Well, can we drill down even farther into a zip code? And we can't always do that, but just the various expertise and knowledge that came from the community members, and they were able to take a look at the data and then connect that back to, oh, I know a program that served young mothers, and that's probably why we were doing better on that indicator versus some of the other numbers that they may have been taking a look at. And so having those community perspectives really helped to bring what the data was saying through the profiles to life in a lot of ways.
Yeah, and the intent really behind reviewing a lot of the data, including the data that I used for the studies we've talked about, was so that the strategies that each of these coalitions determined under the Empower Action model were data driven, right? So they weren't just based on stories or anecdotal experiences, but that they really took the time to look at indicators to help decide where they're going to focus their efforts on, because we also know that ACEs are a very complex issue and that you can't solve everything, and you have to go at it in many different ways, and sometimes with limited resources it means prioritizing certain ways over others. And so that has been a really cool way to help the ACEs field move forward, because we have been sharing our best practices around interpreting and understanding ACE data with other networks across the country as well. And so that has just been really rewarding as a researcher to see people wanting to learn how to use data. And then the other way, really around the disparities and racial equity piece, that has been certainly a challenge in practice. So I was also hoping that Michael could share a little bit about how Resilient Richland has grappled or kind of acknowledged the role that racial inequities play with ACEs, especially as the field moves in that direction.
Sure. Race equity has become pervasive in our national conversation, and we've seen the same thing with our coalition work. And it's been a difficult conversation that some folks are not quite ready to have, but you can definitely see, also taking a look at the data. We don't have it on the county level, but we've had it disaggregated by race, so we can take a closer look at what it looks like on the state level. And we've worked really closely with the coalitions to ensure that there are tools available for them to use as a part of the planning process. And so race equity is a foundation of the Empower Action model, but as Aditi mentioned, putting that into practice has been a little more difficult. And we've connected 7 steps to developing racial equity, a tool from the NEEKC Foundation. And we're also having the coalitions sort of check their plans by using that tool, using the race equity impact assessments that are available as a part of that tool to just do a check and see that we're not having a negative impact by implementing some of the strategies that we've chosen.
I think that's really important that you're being so mindful, because these ACEs are so nuanced, and you want to make sure that, you're, as you mentioned, implementation research is kind of blossoming more now, and really thinking about how are we doing once we have the data, what are we doing with it, and how are we doing that with our communities. And I was curious, if someone wanted to teach your model or apply your work outside of perhaps where you are and where you have this structure, what might that look like?
That's a really great question. And one of the reasons why we wanted to make the Empower Action model paper open access is because we wanted to make sure it was available to everyone, including those who may not be in academic settings or have access to peer-reviewed publications. The chart that is provided, or the table, as well as the model itself, can be used to map out a lot of different things. It could be used to serve as a check on existing strategic plan or agendas that people have created around ACEs. It could be used by a state public health department to determine their priorities around their statewide health improvement plan. It could also be used by an organization that just wants to see if they are doing the right things internally to promote well-being and resilience of their employees. So there's a lot of different ways that it can be used. Of course, as I mentioned earlier, and as Michael has been talking about, one of the ways that we see it being used specifically in a community-based setting is through coalitions. And in our case, our coalitions are interested in working on every level of the Empower Action model. That doesn't mean that you have to do it that way, but we certainly know through public health research that individual behaviors are affected by all of these social, environmental, and policy factors. And so in order for us to really see meaningful change over time, it is obviously ideal to work on all of those levels. But we've been really pleased by the interest that we've received and support that we've received from a lot of other champions in the ACEs space, including those who are maybe just starting on their ACE prevention journey, all the way to those who have been leading those efforts. And so I thought maybe Michael could share a little bit about what are some of the things that we are doing in order to help those that may be interested in using our framework for their own work.
Sure. Well, as Aditi mentioned, there are a lot of organizations similar to Children's Trust, child welfare agencies. Children's Trust is also a part of the Prevent Child Abuse America Network and the Children's Trust Fund Alliance. And so there's organizations like us across the country who are working to develop coalitions or work with coalitions to develop those community plans. And for organizations like those, we have developed an opportunity for folks to license the model from us, including all the tools that we've developed as a part of the process. And so there's a toolkit that goes along with it called the Ready, Set, Go guide. And within there are a whole set of process and procedures for community organizations to go through, and lots of other tools and resources that are a part of a training that we've also developed. So there's a training on the Empower Action model and the coaching process. And we've also developed a training specific to the protective factors that are included in the model. And so we're ready to help spread this information to other organizations who can find it useful in their planning processes as well.
Excellent. I think one of the things that I find really interesting and really exciting about your work is not only, Aditi, did you not take the academic route, that you have put yourself and your expertise into the community setting, but also empowering community members to do the work themselves and identify the right conditions for themselves, and then also creating these tools to implement it. So not just we kind of talked about the ivory tower, and that kind of helping disseminate this information and these good practices and best practices into the community. So I think that's really exciting and really cool to see that it's something that you've made open access so that other people can use this and can apply this, because there shouldn't be like all this red tape around this knowledge, because it's so important that it gets out. So thank you both for doing that effort in order to get this beyond just your own communities. I think for my last question, I just want to know, do you have any parting thoughts on your work around ACEs and COVID-19? I know everything kind of revolves around COVID-19 right now, but I was wondering if you have any concerns or new action items for the future.
So sure, I am really excited to share some of the things that we're thinking about from a research perspective, but I also wanted to note that from a Empower Action model standpoint, I got to be a part of a learning session that the coaches, including Michael, led with the different coalitions, where they talked about how COVID-19 has impacted their planning process using the model. And so I'd love for him to speak on that. But in terms of research, we have been really focused on understanding the unintended consequences of the pandemic on kids. So preliminary data from even the Department of Social Services, and this is pretty, I think, consistent across the board, nationally speaking, we've seen a severe drop in reports of child maltreatment. And on initial glance, maybe that sounds like a good thing, but the reality is that's typically because kids that are in not great situations or in unsafe situations at home are back home. And so they're not around other caring, nurturing adults that can serve as those mandated reporters in extreme cases, right? So one of the things that I'm really interested in examining and actually have a paper under review on is really looking at comparing the prevalence of ACEs on a county level in South Carolina with reported exposure and reported confirmed cases of COVID-19 by race. So that's looking at a lot of those different things we've already talked about, right? We know that the direction of the ACEs research has really gone to understanding equity in early childhood. We also know that it's now seen very much as a social determinant of health, the experiences that you have early in childhood, and then really expanding upon what is considered adversity. And so we're really excited and hope that that paper will get accepted. But the major finding there was that in the counties that reported the highest number of COVID-19 rates, that was strongly associated with also reporting high rates of ACEs. And we also found that those counties were much more likely to have higher populations of Black South Carolinians. So you see a lot of different things kind of going on there, but it certainly confirms some of the things that we've been thinking about, which is that ACEs are really an opportunity for us to prevent a lot of these disparities on the front end. But research questions aside, I think that COVID-19 has had some very practical challenges for implementing the Empower Action model. And so I would love for Michael to share what that has looked like.
Sure. Well, I was thinking as you were talking, Audie, that even before COVID, we had this sort of balance, taking a capacity building approach and also building in some action and quick wins so that the community members would stay engaged and involved and want to participate in the work. And so COVID definitely had that same sort of challenge to deal with. And so we definitely had the opportunity to shift some resources. Thankfully, the foundations and funding streams that we work with were willing to be flexible in allowing the coalitions to make some immediate action. And that also helped us really build some trust with the group as well, to show that we're not just here to teach you about ACEs and productive factors, we're also here to help with the immediate needs that COVID really just brought to the forefront of the community. In Richland County, they were able to move pretty quickly to put together what they called resiliency kits. And so they wanted to be sure that kids had something to do at home while their parents were trying to work, or just to alleviate stress in any way possible. So they were able to put together some activities, some snacks, and that sort of thing. And that went to all the kids at a couple elementary schools in town. And then they were also able to focus on meeting the need of groceries. And so knowing that many folks were either uncertain about their job or may have even lost their job, they were able to provide some grocery store gift cards. And the particular zip code that we are focusing in on is already a food desert. And so that was really important for the coalition to be able to meet that need. As far as the planning process went, COVID actually helped us to be a little innovative, I think, because before we had those in-person meetings and they were monthly, and it's really hard to get everyone into a physical space sometimes. And so moving all of our meetings online gave access to even more people to participate, and we were able to use software to collaborate on some documents, and I think really helped move the process along a little more quickly. And so that was one of the plus sides that came out of having to make some changes.
Excellent. And that's really exciting to hear that although there were some barriers, it seems like there's definitely some silver linings here in terms of increasing, the number of people that can participate in your work. So that's really exciting to hear. Let's see, I think it's time for us to wrap up. So unless you have any last things you want to say, we'll go ahead and close up here.
Just that we have a great team of people, Michael included, that are really doing the hard work of helping communities understand and learn about all the things that make up the Empower Action model. And we are very open and willing to want to help others use this as well. And so we definitely encourage you, if you're a concerned student that cares about ACEs, all the way to a parent or a professor or practitioner that wants to do something, please reach out to us. I'm very lucky as a researcher to be able to work with an entire team that's using this model. And so we're here for you and would be happy to chat with you. And Arden, we'd like to thank you for this great conversation.
Thank you, Dr. Aditi and Michael Shirley, for joining us today. And thank you all for listening in. As she mentioned, you can go ahead and find out more from Aditi or about her. You can reach her here. And as always, you can follow us on Twitter, LinkedIn, and Facebook for more author interviews. Thank you.